Well, Maine is facing a decreasing number of options when it comes to health care for people who are having a baby. For example, since 2015, 7 birthing units in Maine have closed.
A new program could help address Maine's gaps in rural obstetrics. More than $650,000 from the U.S. Department of Health and Human Services is going to the Maine Rural Graduate Medical Education Collaborative, or MERGE, to start obstetrics trainings for students. News Center Maine's Katie Delaney has more.
We're hoping it's going to make a big impact.
The MERGE Collaborative made of 4 Maine-based healthcare providers receiving a 3-year grant to train residents in obstetrics, aiming to bolster Maine's workforce.
Try to get more resident physicians into those rural communities, learning what it's like, enjoying those communities, and staying.
For the hospitals that are part of the collaborative, like Mount Desert Island Hospital, having more skilled students has had an impact.
I can't imagine, not having it now. It really has been great.
6 rural hospital programs in Maine and New Hampshire will take part in the obstetrics training and develop a new curriculum. Leaders at MDI Hospital say this new program will make a difference.
We have one provider who's family med and OB, and she is stretched. And so she's very happy to have a student, definitely a resident, to help.
Dr. James Jarvis, physician at Northern Light Eastern Maine Medical Center, says increasing obstetric services in Maine is important now more than ever.
Very shortly, we're going to have an extreme shortage of providers, particularly physicians across the state of Maine, but nothing near as dire as what we're seeing for maternity care.
Dr. Callie Varaklis, the principal investigator of the MERGE Collaborative, says this program will be able to help fill those gaps in rural areas.
So getting more people means more access, another provider who can see patients, shorten the waiting time to see a provider.
Program leaders will begin patient focus groups soon to learn what skills patients think are most important for incoming students to learn. Katie Delaney, News Center, Maine.
The first students are expected to start their training by the end of the year.
We'll be right back.